Very good evening and welcome to the programme with Anne Davis and me, Dominic Heel.
Good evening. First tonight, we can reveal that the number of children being referred for specialist help for mental health problems has risen hugely across our region, with experts describing the situation as a crisis. According to figures obtained by East Midlands Today, the number of children seeking professional help in Nottinghamshire has more than doubled in 6 years and risen by 50% in Leicestershire. But many of those children have to wait weeks, even months for treatment. Well, this week, our reporter Sarah Teal will be taking an in-depth look at children's mental health. And Sarah's with us now. Sarah, these figures just reveal a shocking rise.
Well, they really do, actually, really shocking, because we asked our Health Trust to tell us how many young people are referred to CAMHS. That's the Children and Adolescent Mental Health Services. In 6 years in Nottinghamshire, referrals have gone up from 2,400 to more than 5,500. That's a staggering increase of 131%. In Leicestershire, over the same period, referrals have risen 50%, from 3,800 to more than 5,700. South Derbyshire and Derby City saw 1,500 children referred for help last year, but they couldn't provide previous figures to allow for comparison. They did tell us, though, the average waiting time for a child to be seen is over 8 weeks. In Nottinghamshire, it's 7 weeks, and Leicestershire, 6 weeks. But that's often the time it takes for children to have an initial assessment. Actually getting help can take much longer. And in Leicestershire and Nottinghamshire, 20% of youngsters who sought help were declined any treatment at all. Now, I've been speaking to young people, parents and professionals who paint a rather desperate picture.
Elodie suffered from severe anxiety in the run-up to her GCSEs, but the 17-year-old from Nottinghamshire found help hard to come by.
In a school of 2,500, there was one school counsellor, which I wasn't able to see because my needs weren't dire enough. On my 16th birthday, I didn't celebrate. Instead, I went to the doctors for antidepressants. They turned me down because I hadn't been able to see the counsellor, the same counsellor that I'd been trying to see for years. I turned to my mum screaming and I said, the only way I'm going to get help is if I try to kill myself.
At that point, Elodie finally received counselling. She passed her GCSEs, but with lower results than she'd hoped.
I know my potential, I know what I can achieve, and I felt like I was given challenge after challenge after challenge after setback with no support, and therefore I couldn't achieve what I should have done.
Unfortunately, Elodie's case isn't rare. Rachel Bannister is from Nottingham. At the age of 13, her daughter sought help for eating problems.
I think it's one of the most awful things to endure when you see your child so ill and dicing with death, and then to be told that she needs a specialist care, and we know what she needs, but then being told that you've got to wait several months, or actually not being given a timescale. It's horrible, it really is. It's an utter nightmare.
At 15, she was eventually hospitalised, diagnosed with anorexia. The only bed available was in Scotland.
It was just utterly heartbreaking having to take her so ill all that way. That was undoubtedly the most horrific thing that's happened to our whole family.
I don't know what the answer is. There isn't enough support for kids who need the help now.
Kate Majid was a mental health nurse for 30 years before stepping away to head up Newark-based mental health charity, the Shaw Mind Foundation.
Would you say there is a crisis in mental health in children?
I think there is a crisis, an epidemic almost, of mental health difficulties for children and young people. We see a rise in young people who self-harm as a coping mechanism. We've seen a rise in generalised anxiety, a rise in depression for young people.
GPs can refer children to CAMHS, which stands for Children and Adolescent Mental Health Services. But youngsters have to wait weeks or even months before receiving treatment. The knock-on effect is that schools find themselves having to pick up the pieces.
We are finding more and more that parents are taking their children to the GP, and GPs are saying, oh, let school deal with it. So we are really under pressure, and also the cuts across the services. We're finding waiting times are increasing vastly, and that's 6 to 10 weeks.
It has a devastating impact on children's learning. At the moment, schools are struggling to fund just the sheer basics. So the idea that schools are able to fund, the support services, the counsellors, the pastoral support, is just not realistic. And of course, this comes at a time when mental health provision in general is being absolutely decimated across the NHS.
A year on from her struggles, Elodie is managing her anxiety.
I'm working as a teaching assistant and I thoroughly enjoy it. I work one-to-one with an autistic boy and it's absolutely amazing. My struggles, I feel, help me help him because I've been through it and I know what it can be like in the system.
Well, let's talk now to Kaz Narman, who is a consultant at Nottinghamshire CAMHS, the service group that we heard Sarah mention in her report. Thank you for coming in. Now, Elodie spoke so eloquently, really, about her issues. Do children, as she suggests, do they have to be at crisis point before anything can be done for them?
It's a tricky thing. There's an increasing demand for CAMHS interventions with young people. Anxiety is on the rise. And as a result, I think young people are being seen quite late. After struggling for a considerable while. I think there's a gap before young people talk to their parents and then the GP and then the school. Within CAMHS, we are trying to reduce waiting times, although our referral rates year on year are significantly increasing.
You're talking about the waits. I think I'm right in saying that in Nottinghamshire, the aim is to see somebody in 12 weeks. But, if you had a broken leg, you wouldn't be left with your bone hanging out, would you, for 12 weeks?
Absolutely, and there is no parity of services for mental health and physical health.
So what's the issue? Is it simply a lack of funding?
I think that is a significant part of the issue. Mental health gets about 1% of the NHS budget and CAMHS gets a small amount of that percent as well. I suppose the other issue is thinking about some of the preventative stuff. How can we prevent young people of reaching the point where they need a CAMHS service?
If we've got this rise in mental health problems in children, why have we got this rise?
There are lots of different factors. There are social factors, economic factors, our education system, pressures of social media. So they're multifactorial. And I guess it's thinking about how can we help young people to stop reaching that point. There will always be young people who need a CAMHS service, but that huge rise in the number of young people in distress, there has to be something as a society that we do differently.
Yes, indeed. Very concerning, isn't it? Kaz Narman, thank you very much indeed.
Thank you.
Pleasure.
And for more information about organisations which offer support to children, you can contact the BBC Action Line. Tomorrow night, we'll be looking at a rise in mental health problems among primary school aged children.